Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Olson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. If I sound a little tired, it might be because I just recorded this episode and didn't realize I forgot to turn my microphone on. Goodness. All right, let's try this again. Many people who join my Smart Weight Loss Coaching program are referred by their doctor or some other healthcare provider. Recently, a colleague who used to refer a lot of women to my program stopped sending so many people my way. What used to be a steady flow of people joining our membership program from her practice decreased to a trickle. I asked her why, because of course I was worried that someone may have had a bad experience, and I definitely wanted to intervene if there was a problem. She shared that those who joined my program gave her wonderful feedback and found it helpful, but a few people got angry with her for bringing up their weight when that wasn't the main reason for making the appointment with her in the first place. Some people pushed back when she brought up their weight, and a few directly said that they were offended and thought it was rude of her to mention it. She was afraid to bring it up anymore, even though she was sincerely trying to help. At first I was stunned, but I guess not really surprised to hear about these exam room conversations that were stressful for both the doctor who was trying to help and the patient who was ready to talk about the immediate reason for their appointment, but didn't want to dig into the root cause of the problem, which in this case was the weight. What I've seen over the years is that many well-intended docs who are 100% committed to helping their patients are stuck between a rock and a hard place on this topic. And honestly, we all know that not everyone is unbiased. Sadly, weight bias is alive and well throughout our culture, including in the healthcare industry. Today, I'm not talking specifically about doctors who are biased against patients who are heavy. That's a thing which endlessly disappoints me, but it's a topic for another day. I'd like to talk instead about how hard it can be for everyone involved when doctors bring up excess weight during a medical encounter, but the reason for the appointment is something other than a request for help with weight loss. When doctors bring up excess weight as a concern without asking for permission first, it's often received poorly. I hear from both patients and colleagues about how awkward these conversations can be and how even a well-intended inquiry about weight can be received as extremely hurtful or judgmental. If you haven't personally encountered this or aren't sure what I'm talking about, let me give you an example. Let's say you go to see the doctor for knee pain that's been getting worse for the past 3 months when you started playing more pickleball. You just want your knee to feel better and you want the doctor to focus on that. Your doctor spends a few minutes talking with you and examining you to determine what's up with your knee pain, but immediately hones in on the fact that your knee probably wouldn't be an issue if you weren't 30 pounds over your ideal weight. Here comes the conflict. While it's true that many knee problems are related to excess weight, not everyone wants to talk about that. You might want the doctor to focus on treatment for the pain today, and then zoom out for a discussion about how to reduce weight to reduce strain on your joints at some other time. Or maybe you don't want to talk with this specific doctor about your weight at all. Or maybe you do want to talk with her about your weight, but just not today. Today your knee hurts and you're busy and you weren't prepared to do a deep dive into this highly stressful topic of weight. As doctors, we don't know whether people want to talk about their weight unless we ask for permission and then wait for an answer. I find this fascinating because it flies in the face of what we've historically taught doctors in training about their role. They're trained to offer unsolicited advice about everything that impacts health, from wearing seatbelts and bike helmets, to getting vaccinated, to wearing sunscreen, to suggesting that people quit smoking or reduce their salt intake. But there's something about excess weight that has made this a loaded topic of discussion, even in the doctor's office. On a slight tangent, I love looking back at the research about counseling people on smoking cessation, because when I first started in medicine, a lot more people were smoking, and this was a hot topic for research on how to help people with behavior change. Research on smoking tells us that people are significantly more likely to quit when their doctor advises them to do so. Not because they didn't know it was a problem before, not because it was suddenly easier when your doctor told you that you had to quit, but most likely because people considered it a more serious issue when their doctor treated it as a medical concern. In one meta-analysis incorporating 28 trials and over 20,000 participants, a brief advice intervention delivered during a medical visit for a different issue resulted in a higher quit rate than the very low 2 to 3% annual quit rate that people had without any advice. This research comes from a time when smoking rates were much higher in this country, but it demonstrates the value of healthcare providers speaking up. That research also tells us that a brief conversation is enough, and that talking about it for twice as long or giving extremely detailed advice didn't incrementally increase the quit rate further. It was enough simply to raise the concern and ask if people wanted further support, which might involve written materials, a referral to a smoking cessation program or specialist, or possibly a conversation about resources, including medication that might help people quit. For a while, people talked about smoking status as the fifth vital sign, after checking blood pressure, pulse, temperature, and respiratory rate, because routinely asking someone if they smoked was an easy way to initiate that brief conversation. Today, weight, or in some cases BMI, has become that fifth vital sign. You can go to the doctor for a sprained ankle, and they'll check your weight. And they might spend part of the visit talking to you about your weight, even if you had no intention of going there. I think we as healthcare providers are extrapolating data about the value of brief smoking cessation counseling and assuming that the same thing will help people with weight loss. Unfortunately, I think we're wrong about that. We're upsetting people when we bring up their weight because it may feel like an unexpected sneak attack or a criticism. Why is having your doctor mention your weight different than your doctor asking if you smoke or if you've ever thought about quitting? I think there are a few main things at play here. First of all, there's such a societal stigma around weight, even though 42% of people in the United States have a BMI of 30 or higher, which is the cutoff for a diagnosis of obesity. If you look at the combination of overweight and obesity, 73% of us in this country are carrying excess weight. We're all in this together, my friends. If we don't personally struggle with our weight, we love someone who does. And yet, despite the fact that carrying excess weight is so common, there's still plenty of shame involved, which is why having someone bring it up unsolicited can be incredibly jarring. Secondly, people typically find it much harder to lose weight and keep it off than to accomplish other health goals like quitting smoking. When people work on quitting smoking, the action that needs to be taken is quite clear. Tackling excess weight is a much more complex puzzle. What we eat and how much we eat are only two pieces of that puzzle. Weight is also impacted by genetics, including genetic mutations that can happen in childhood and even adulthood. Our environment impacts our weight. Our sleep and ultra-processed ingredients that have drastically changed our food supply, our built environment, and technology that's reduced the amount of movement we get throughout our days. There are medications that cause weight gain, including antibiotics that may change our gut microbiomes. Our hormones and our biology are impacted by the different world we live in. And of course, stress impacts our weight too. In other words, weight loss is a lot more complex than just eating less and moving more. People are trying, and it's so discouraging to work hard at something and feel like you're not making progress. So when a doctor tells you to lose weight, it might feel insulting because that's exactly what you've been trying to do for years. It's typically not a newsflash that weight loss would be helpful, but what people need are science-backed strategies that move beyond the generally unhelpful advice to count calories. We've been counting calories for decades, and it's not working. I get that. And on that note, the unhelpfulness of calorie counting, let's pause for a word from our sponsor. Ha, just kidding. It's still me, Dr. Lisa Olson, founder of Smart Weight Loss Coaching. If you're as focused on your health as you are on the scale, you're my person. In my online program, we'll help you establish healthy habits for weight loss, better health, and longevity. For those of you who have looked at our website before, you'll be excited to see that you no longer have to commit to a 3-month program to join us. If you'd like to learn more about our affordable monthly membership, head over to smartweightlosscoaching.com. Okay, back to the 3 reasons it feels unwelcome when a healthcare provider brings up weight. The third reason is because doctors themselves are often untrained and ill-equipped to help people, and that's certainly true in the context of a quick office visit for another issue. It's both a matter of timing and training. With most doctors having so little time to talk about weight management, and with so few of them having been trained in the latest research, I understand why patients feel frustrated to have someone bring up this sensitive topic and then talk about unhelpful concepts like counting calories, eating less, and moving more. With smoking cessation, there was mainly one straightforward action that a person needed to take. Back when I used to do primary care, the research said the average person tried to quit 7 times before they quit for good. So it wasn't easy to quit, but giving advice about the most effective quitting technique was pretty straightforward. Make a plan, set a quit date, tell people about your plan to get support, change your routine to avoid your triggers, and don't give up if you don't succeed the first time. If you keep trying, eventually it will click. We can't simplify it in the same way for weight loss. Most of the people I work with have been actively trying to lose weight for years, if not decades, by the time I meet them. When I start working with people, I have the advantage of their unspoken consent to talk about their weight because that's my job. They've signed up to work with me on weight loss, so I don't necessarily have to ask permission to bring up their weight. They're eager, or at least willing, to talk to me about it, which makes it less loaded for both of us. I'm able to invite them to tell me their story, and I always ask about their victories along the way, what they've tried and what worked, what they know about what helps them to succeed with weight loss. Then, because I know they'll have some insights, I ask about where they think they're stuck. My job is a lot easier than other healthcare providers because I don't generally meet people until they're ready and willing to talk about their weight. We know that asking permission to talk about weight is a more sensitive way to approach it than the way we're used to driving other conversations in the exam room. That's why we now teach doctors to start by asking. Not everyone is ready, even when weight is the cause of their current health concern. For example, let's say a person has back, knee, or ankle pain that's probably caused by or exacerbated by their weight. Or type 2 diabetes or a weight-related cancer. We can still ask, is your weight a concern for you? And if so, would you like to talk about it? Or would you like some help with your weight? Some people are eager for help and will say yes because they're ready to talk about it. Others find that intrusive, and we should drop the topic at this time because pursuing it further only serves to erode the relationship. They now know that the door is open if they want to address it in the future. When we ask if someone is open to discussing their weight, it's important that we make it clear that we're here to help with the problem at hand either way. For example, I'm going to help you get your blood sugar under control. And if you're interested, we can talk about the connection between weight and diabetes and how I can help you with that too. I know a lot of healthcare professionals who listen to my podcast and join my program themselves to learn how they can lose weight and how they can more effectively help their patients. So for just a moment, I'm going to talk to them. But please stick around, even if you aren't a doctor or other healthcare provider, because you might be interested to know that this is a tricky topic for all of us. We have a system called the 5 A's that can be used to approach a discussion about weight with compassion. The 5 A's are ask, assess, advise, agree, and assist. This is a counseling framework that's more helpful for weight loss than jumping straight into giving advice. Number 1, ask. Ask the patient for permission to talk about their weight, and only if the person is willing should we continue the conversation. If not, then compassionately move on. Perhaps the person isn't ready. Perhaps you're not the healthcare provider they want to discuss it with. Or perhaps now's just not a good time, and that's a good enough reason. We can ask, but it's always up to the patient whether or not we go there. Number 2, assess. Assess the patient's readiness to change and identify areas to focus on. Give credit to our patients for what they already know and what they're already doing well. For example, I don't assume that everyone carrying excess weight needs to exercise more. I always assess that rather than assuming. I have patients who are super athletic at every size. Try to assess a person's strengths as well as their sticking points. Number 3, advise. This is where the doctor provides clear advice to the patient. And this is where many doctors struggle. If you aren't trained in the latest science of weight loss, that's okay. I don't try to manage someone's kidney disease, and you don't have to be an expert in everything either. As of January 2025, there were almost 10,000 physicians certified in obesity medicine in the US and Canada, including 1,800 new physicians who just passed the certification exam in the fall of 2024. And there are also many nurse practitioners and physician assistants who have earned certification through the Obesity Medicine Association. Everyone doesn't have to be an expert in everything. Sometimes advising a patient simply means advising them that effective help is available. Number 4, agree. The clinician and patient may agree on general weight loss goals and a treatment plan. But again, here I think we can look at the smoking cessation brief counseling model. If your patient agrees to talk about weight and you're not sure how to provide meaningful help, it's okay to move right to the 5th A, which is assist. Here, the provider helps the patient with ongoing weight loss, which may mean assisting them in finding a program, like my Smart Weight Loss Coaching online program or another program in your local area. And if you're working with them on weight loss personally, you'll help them at each stage along their weight loss journey, which might mean supporting their weight loss in an intensive lifestyle modification program, using medication, or both. Assistance also involves helping with maintenance of weight loss, which is something that doesn't get enough attention. Circling back to my well-intentioned colleague who had a few rough conversations with patients that were offended by her bringing up their weight, my tango teacher, Rod, recently offered some advice for tango leaders attending their first social dance called a milonga. He said, if you ask someone to dance and that person declines, don't take a sensitive pill. It might have nothing to do with you. Her shoes might be killing her feet. She might have just told someone else she would dance with them for the next song. Or maybe she's a little tired and just wants to sit this one out. Graciously take no for an answer, and you can always ask again at some future time. I love that advice. As doctors, we're not used to people declining our offers to help them, but it's okay. You can invite or ask your patient if they'd like to talk about it, and you can skip the sensitive pill if they say no. It's nothing personal. It's their journey. Okay, now I'm talking with everyone again. We can all do our part to reduce the stigma and shame that people experience about their weight. We live in an obesogenic environment, and it's tough. Weight gain has become the norm in our society, but there are things we can do. So, if your PCP, your cardiologist, your gynecologist, your endocrinologist, or orthopedist ask for permission to inquire about your weight, please consider inviting them in and hearing what kind of resources or guidance they have for you. And of course, you should always feel empowered to say no if your shoes are killing you or it's just not the right time to dance. This was an unusual episode, but we can always find an NBA, a next best action. Maybe you want to talk with one of your doctors about how they can help you with your weight. Or maybe you want to work with me because you're as eager to focus on your health as you are on your weight. Whatever your NBA this week, please know that your weight matters, your health matters, and most of all, you matter to me. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.